Hi, my name is Dinesh McCurdy and I'm the founder of Stasis. We're sitting here today with Dr. Medha Rao for a fireside chat about her experience in healthcare delivery. Dr. Medha Rao, could you please share a quick background about your experience?
So, hello Dinesh, I'm Dr. Medha Rao. I'm actually quite happy to share my experience with you.
Thank you so much.
I'm a physician and professor of medicine as well for over 3 decades now, and with a special interest which I have developed during my course as a physician, special interest in treatment of the elders. I'm also quite happy to run a diploma course which is affiliated to IGNOU University, which deals with geriatrics in particular. And I did enjoy, I must share with you something about my achievement, and I quite enjoyed contributing 2 chapters in a textbook of medicine which is called the Davidson's Textbook of Medicine, which is quite widely used world over.
Exactly.
And I'm also quite excited to inform you that both the chapters related to care of the elders. It was a case report about the elders.
That's very great. Yeah, I think you forgot to mention you were also the dean of the teaching hospital.
Yes, incidentally, I'm the principal dean of a Ramaya Medical College.
Fantastic. So you have a lot of people.
So I have dual responsibility and roles in this college because I'm a clinician as well as an administrator. And
I think that's the key reason to learn a lot from your experience throughout the healthcare delivery. It's hard to be both a clinician and an administrator.
Yes.
I'd actually love to understand, you mentioned one of your focuses and passion is geriatric medicine. What are some of the issues that you face in your day-to-day work?
Now, I must tell you at this point of time that elders, or as it is referred to as geriatrics, are really a special category. Because whatever we plan as a healthcare for the elders has to be absolutely customized.
Why do you say that?
Because they have a reducing physiological reserve, which is referred to as homeostenosis.
Okay.
And they behave very differently in response to stressors. And when I say stressors, I'm referring to either an accident or an infection or a trauma or any acute illness for that matter. So their response is something which is unpredictable and which is, not like the younger counterparts. And what I would generally like to share with you is, in geriatric management, it's never that one size fits all. Rather, it is one size fits one. And so we have to be very careful in both assessing, evaluating, clinical impressions, planning the care, and monitoring the response. And it's a long-term monitoring for the simple reason that they recover very slowly, and whether they bounce back to pre-illness is also questionable, and we aim at giving them a good quality of life at the end of, say, few weeks.
Exactly. So patient stability is probably something that's very difficult to...
Yes.
Yeah, it's reduced and you don't know when the patient's stable.
Exactly.
Because the care path is such a long period.
And also you can categorize them as vulnerable group.
Okay.
For the simple reason they are prone for multiple comorbid states.
Interesting.
And each has a bearing on the others as far as the treatment goes. They are more prone for adverse effect of medications. They may not tolerate the same doses as well.
So you have a lot of variables you have to consider.
A lot to take
simultaneously.
Care. That is why we generally refer to it as a comprehensive assessment, comprehensive evaluation, comprehensive care.
So when you look at multiple variables, one of the first thing a technologist like myself would offer is technology. Technology is really great at taking multiple variables and assisting clinicians. Can you share a little bit about how technology, how does it help clinicians, and maybe how is it difficult to even bring in?
See, a good quality care for an elder, let me presently refer to only a hospital setting. It's a team effort. So it's the clinician assisted by the support staff, primarily the nurses. So if I'm trying to look at how a technology can help us, so a technology should be something which would assist the entire team to make a reasonably rapid evaluation of the patient's state, and it should be quite accurate as I said, because for me to plan my treatment. And if it's going to be continuous, it's going to be an additional help for us.
So there's a lot of technologies available today to hospitals. As an administrator, what are some of the challenges of trying to adopt that technology into the hospital system?
Technology is available these days. Often it is at unaffordable cost. Often, I'm referring to. Information about technology is easily available for the public. Demands of the society for high-tech and high-end treatment is also there. Medico-legal issues are also creeping in. Hospitals are therefore willing to have the technology because they have to satisfy all these requirements.
The clinicians are hard to move
Clinicians
into this.
are hard. I'm a clinician, so I'm definitely going to talk in favor of the clinicians. Clinicians just should be a little more willing. And what you need is, if the technology has to be implemented and introduced, training the clinicians, convincing the clinicians, training the support staff and all the end users, because it's a team effort, is very, very critical. Alternately, you should be training them as groups. And the next thing which is a requirement is, as I said, easy to operate and a support, because we will not be able to deal with any of the breakdowns. I mean, I would think so.
Yeah.
So
you have to have
therefore,
the end-to-end
I need,
experience.
yes, once that is guaranteed, then the administrators also would be quite willing to implement the technology.
So, Dr. Medha Rao, can you share how technology helps you in managing in healthcare?
When you're referring to healthcare, you first need to know that healthcare is of different aspects. One is the outpatient and the hospitalized patient and post-discharge. And technology can assist the clinicians in different ways. What we look at is a technology to assist us, one in diagnostics, quick assessment, and to monitor the patient care after discharge if it's an institutionalized patient. Number two, I would expect technology to be cost effective, and I would expect technology to be easy to operate.
In technology implementation, you're talking about technology in the hospital, but also post-hospital, especially with geriatric patients. I'm sure many of them want to go home and be taken care of there.
It would be wonderful if the technology is going to be there in the hospital during the patient's stay. And let me mention that the older patients, the family caregivers would prefer to have them back home much earlier. And for clinicians, comfort and good quality of care at home, which is referred to as domiciliary health care, technological assistance to monitor the patients at home would be very, very useful. Added to this, if there is a possibility of a technology which is easy to use, the family caregivers will be able to use, but also if there's a possibility of connecting with the clinician, it would be wonderful and of great use. Because then the clinician would feel comfortable sending the patient home.
And that's the key. If we want to treat more patients in hospitals, we have to be able to distribute where patients are and keep treating them. Well, thank you so much, Dr. Medha Rao. I'd like to wrap up with one last question. Can you share some of your thoughts of where Indian healthcare is going? You know, you're a leader yourself. We'd love to hear your thoughts.
If you're referring to the national level where healthcare is going, there is awareness that healthcare needs to be distributed across the board, all socioeconomic strata. It has to be good quality healthcare at an affordable cost.
Cost effective.
And in Indian setting, we have both government and private players in healthcare delivery. Everybody is looking at penetration into rural areas, which seem to be getting just the minimum kind of a healthcare. So if there's any technology assistance, it has to be cost effective. Again, I'm repeating, it should be easy to use and easily manageable, so that you are going to extend the healthcare services to the rural areas as well. And let me tell you, the private players are equally interested as much as the government players are, considering the fact that we are all aware of corporate social responsibility.
Exactly. Well, thank you again, Dr. Medha Rao. Thank you for your time. It's a great pleasure to always sit with an industry leader.
I
and
enjoyed sharing
understand
my
this.
experience as well.
Perfect. Thank you so much.